Be, as always, county government remains open. We do want to encourage people as well to be sure to complete the application for a mail-in ballot for the June 2nd primary. This is a great way to protect the others in the community, but also a great way to protect our poll workers this year. And want to thank everyone for the great return to business meeting yesterday. It was fabulous. A lot of great information. Everyone was wonderful and really great for the community. So please check out that recording if you have a moment, if you weren't on the call. And also just to remind everyone in the business community, in the county outside the city, that is involved in some sort of business related to tourism. We are still accepting applications for grants for small business support. Please go to co.monroe.in.us and apply. We've granted over $165,000 so far. And the Food and Beverage Tax Advisory Commission has okayed additional funding. We are waiting on a council appropriation on Tuesday. But in the meantime, please apply, even if you've applied before and your needs have increased again because of the extended stay-at-home order locally. So thank you for that, and I'll take any questions at the end. Thanks.
All right, thank you very much. And Mayor Hamilton has come in. I've noted the rate your background things that are appearing on the internet. So I note that you have a bookcase background this week. It's a nice change here.
Doing what I can, Chuck. It's nice to be by a window. Thanks. It's good to see everybody again. And I'll just note a few things. It was a week ago. I'm sorry, I missed the very beginning. You guys jumped a little ahead of 1:15 for me. Anyway, sorry I missed the beginning of Commissioner Thomas's report. A week ago, the governor made a major order. I want to give one plus to that order was an explicit acknowledgement of local control, which not all governors in the country have done, and I appreciate that from our governor. I would note, from my perspective, a concern as well. I do believe the state's modeling and forecasting is very aggressive. Some of you may have noted the reference in articles that there are 3 states that have moved forward with reopening while their caseloads continue to rise. We're one of those that was noted that way. Some of you may have noticed a recent report that projected Indiana as the 2nd highest state in terms of a percentage increase in deaths due to actions in our status, from a predicted 1,000 to a predicted 6,000 by August. Now, these are, of course, models, predictions. We, of course, hope to do better than many of these, but it does, to me, continue to affirm kind of the caution that we need to take as we here locally continue to focus on data and relying on the health expertise and the outstanding institutions and individuals who I will continue to give shout outs for on their leadership, from Penny Cottle and Dr. Sharp to Brian Shockney and the institutions they represent, and others who protect our public. We remember that the very first goal of government is to protect public safety. That certainly includes in a pandemic, infections like this, that we focus on protecting public safety, number one. The state actions are one approach that we certainly view as instructive and helpful, but we are going to continue locally to identify what is the best course for our community in terms of protecting our health and safety. And I would also just add the great collaboration that we see among all the government partners and the health partners. I think it's been a really terrific team to work together. I'll just note briefly also a second role of government. I've mentioned this in some settings, but government does have a role to be what I'll call counter-cyclical, meaning we really do need to work to try to slow and reduce the costs and the pressures and the economic costs of a crisis like this, as well as trying to accelerate the recovery. And I'm very pleased that the Economic Stabilization and Recovery Group that has been doing great work. We set them up almost 2 months ago now, and they have, including a major loan program, over $1 million committed, as well as some of the seminars and outreach from the chamber and the planning from the BEDC. So I'm really thankful for all the folks trying to help do the recovery and the reopening that we all want to see, and to do it in a good way. City government continues to operate. We have made announcements that we will not open City Hall and some of the other facilities before the 18th of May. We haven't determined, and we'll announce that next week, the next steps on that, and look forward to collaborating with the county on that too, as we continue the operations. But I want to thank everybody for what they're doing, and I'll be happy to answer questions as well. Thanks so much.
Thanks very much, Mayor Hamilton. And again, for media, we will take questions. You can put those in the chat here on Zoom, or you can actually ask them here on the Zoom broadcast itself. And Mayor Hamilton, I will apologize. We did start a couple of minutes early. I realized I went by my computer clock, which for whatever reason is 3 minutes faster than my phone. I assume that that's something Indiana University has done internally to keep me.
Maybe it's for your own computer, you think they did? Yeah. Well,
yeah, I think so.
Charge ahead.
Okay, so next let's go to Brian Shockman.
Thank you, Chuck. And I need those 3 minutes early for myself and my schedule as well. I like that approach. Thank you, Indiana University, for that good insight. First of all, I just want to thank, last night we had the Monroe County Police, Fire, first responders, Ellettsville, from all over, who did a drive around the facility and drive through the facility for our night shift and evening shift. We had over 100 people out celebrating, lots of our staff and others in the windows to be able to experience that. And I tell you, it was very uplifting, and talking with our team members afterwards, rounding in the departments and talking with them, it was overwhelming. And so thank you to them first. That was incredible experience. Thank you to both Julie Thomas and Penny Githens for joining us. That was great to have you there, and several of our team members were just really pleased to see you there and the support that you provided. And then Allison, for your team as well. So just thank you so much. It meant a great deal. And so we continue to work, IU Health continues to work with the State Department of Health on a state level, looking at his phases and the orders, as Mayor Hamilton alluded to. I first want to say that we are proud of our leaders in this community who made the decision. It was a tough decision by our health department to keep the order in place this past week, but it has been the right decision. And in a minute, I'll show you just from our numbers why that was the right decision. And then reopening of services. So we are starting to reopen our clinics. We're starting to reopen our therapies. We're starting to reopen several of our services in our community, and we're opening them very slow. We're being very methodical about it. We will not open any more than 25% of the volume that we were seeing prior to the service closing because of COVID. We will be doing testing on our patients. We do have all the precautions in place for masking all of the patients, screening patients, all of our team members being safe. And so we are starting that process very methodically. We have what we call recovery teams who are going into each location. They are made up of 5 individuals who are experts in facilities, infection prevention, in operations, in nursing, and infectious disease. And so they're going in and looking at all of the operations to be sure that these locations are ready for patients, ready for our team members, everyone is kept safe before we go forward. So that will take some weeks for us to get that up and running. But you some time. At the same time, we will be doing our virtual visits. So as I think I mentioned before, we were doing about 5 virtual visits a day, and we are up to over 1,500 virtual visits per day through COVID. And we're finding our patients are very pleased with that. And our choosing that virtual visit over going in person as well. They're very efficient, very effective, and the one-on-one time with their provider and screen time is seen as a very positive. We are continuing our visitor restrictions. That this virus is still very prevalent in our community, and Penny will be able to share some of that, I'm sure. So we do not want to be, we want to protect our patients and our team members, and we want to be sure that we are doing everything that we can according to CDC guidelines and it's a health facility to protect our visitors and our patients. So visitors restrictions is one of those. Masks on everyone and surgical masks on everyone. N95s on those who are caring for patients who have COVID, and then cleaning. We continue to be sure that we're doing the highest level of cleaning that we can for all of our locations and our services. And then social distancing, ensuring that we continue to not allow our team members to sit in the cafeteria together unless they're 6 feet apart. All those things that we require and think are the best practices in the community, we're also doing those here in our facility. So I just wanted to share that. Let's go to the slides if you would please, Chuck. This first slide is the slide that demonstrates, and it's from the Registry Institute. It's what you can get out there if you just go to the website. And it shows here the decline in numbers of hospitalized individuals over the past several weeks that Governor Holcomb was looking at. And so you can see where we were seeing some declines in hospitalizations, which is only an indicator of the severity and the overwhelming of hospital operations. It is not a indication of the prevalence of the virus in our community. So we just want to be sure that everyone understands that as we make decisions as hospitals. Go to the next slide, please. And in this slide, I wanted everyone to understand that when Governor Holcomb was making his decision regarding moving to phase 2, as I said last Friday, we still have had a very fair number of individuals in our hospitals. And we are in contact with Monroe Hospital as well as IU Health here, Bloomington, and these reflect both numbers. And so at the time the decision was made, we saw that we were, if we'd had another surge, we would not be able to handle it. And so we gave that information to the local officials and to the health department, and we believe the right decision was made. As you can see, over the past 5 days, we've seen some additional decrease in the numbers, both at Monroe Hospital and here. And what that tells us is that the right decision was made, and that because we are doing what we're doing with masking, social distancing, and not allowing large groups of people to meet, that we're seeing the severity of this disease decrease as we want it to. And also we're seeing that those who are most affected, which we know are the older, elderly, more aged, I guess, that they're not getting it at higher rates because they're following those protocol. And so that's part of that hospitalization as well. So I wanted to share those two with you. Again, those are not indications of prevalence in our community. They're indications of we're doing the right things to be sure that the right people do not get this virus and that we don't have high acuity and overwhelm the healthcare systems, both Monroe Hospital and IU Health, which has then allowed us to begin to see patients at that 25% level over the next few weeks. We will now be looking, we now look at how do we ramp down operations. We've been looking at 4 different models. There's several models out there, as the mayor was alluding to. Some are like, like a camel's hump, they keep going up and down, or will we see a summer of low cases in the hospital, and then it'll peak back up even more so in the fall? We don't know the answer to that. So we're being very cautious, and we are going to open up operations to where we believe we can then quickly turn around and care for patients in our ICUs, on ventilators, and care for the community without stressing and overwhelming the healthcare system here in the South Central region. And that's the conclusion of my comments, and I will take questions at the end.
Okay, thanks very much. Let's go to Penny Caudle.
Good afternoon. Thank you very much. I want to start today with a little bit of good news. We've been talking about testing and increasing testing over the next couple of weeks, and with additional testing sites should be operational next week. So by Thursday, it could be as early as Wednesday. We're very hopeful that it will start on Wednesday. But certainly by Thursday, the Optum site should be up and running. It will be free. Insurance will be billed for those who have insurance, and it will run Monday through Friday, 8 to 4. Appointments will be made through a portal, and it will be that process that you look for eligibility. But some more good news is that eligibility guidelines have loosened up. So one of the changes is that people in high-risk group, people who are 65 and over with chronic diseases such as diabetes, obesity, hypertension, or high blood pressure, and other underlying medical conditions will be able to test even if they are not symptomatic. So even if you're asymptomatic and you're in that high-risk group, you'll be eligible for testing. Certainly with increased testing and having an additional site, we do expect that our numbers will continue to go up. And we know that that's going to happen. We expect it. So we will see some increase in confirmed cases. With that, that is where that increased contact tracing, the enhanced ability to do additional contact tracing comes into place. That also starts next week. So we have a lot of good things coming in the next week. With the ability to do that in that contact tracing very rapidly, we can identify hotspots. We've learned yesterday, we did some initial training, so we may be able to flag if we see that a large number of people who are testing positive have all been at Home Depot, or they were all at the concert last weekend, that we may be able to see those connections, and then we will be able to respond very rapidly to those situations. So we talked about before that as we look at what to do when we make these public health decisions, we have to look at a variety of information. So we are looking at the number of tests that are being done and how that's increasing. We want more testing in the community. The more testing that's being done in the community, the better picture we have about prevalence, what's actually out there. But we also have to pair that with other information. Are we seeing spikes in cases that are in relation to the increased in testing availability? Did we open up during a particular time and change criteria for testing? And it was during that time that we saw a spike in cases. So those are some of the things that we look at and some of the different pictures that we look at. So we will continue to watch not only the cases, the number of cases that we're seeing, the number of tests that are being done, but the relationship between those two, the percentage of tests that are positive among what tests are done. That's actually an area where we've been doing very well. We've seen a recent small decline, and we want to continue to see that ideally. I would expect some increase to be seen. As I said, I think with additional testing, we will see additional positives. That's just the nature of things. But we will probably also see the percentage of positives go up a little bit, but hopefully it won't go up much. And so we'll be watching that very closely over the next few weeks especially, but as we move forward. We don't know how long exactly this new site will be here. It will be temporary, so it should be here for at least a couple of months, but we will see. I don't think that a full decision has been made about how long it will be here. So again, just keep in mind that we've said before, we look at a variety of information. There is no one set magic number that when we meet that number on that date, everything will resume as it has been before. It is a series of information and a series of conversations about what's happening around those numbers. So the hospital, for example, provides us with information about what's going on in their area, and that plays a part in what we're we're seeing in the whole community. And we have to balance the two, what's going on. So with regard to the stay-at-home order, of course, we are still in stage 1 of what would be the Indiana plan. And again, there's much data there. There's a lot of conversations about what's happening in the community. No one set of numbers. We did have a business meeting yesterday that went very well, I think, and we hope to be able to provide additional guidance for businesses as they open up. And we're very grateful for the work that the Chamber and others are doing to provide our businesses with lots of information about how they can open up safely when that time comes. Now, the not so good news is that we actually saw 11 new cases this week, and we had an additional death. The upside to that is that percentage that I mentioned earlier of positives did not go up. So again, it's watching that balance of those. We will factor all of those things into our decisions, including the hospital's capacity, upcoming testing that's going on, and we'll make a decision next week. Can't make it too early, but we do want to make it as early as we can to give people a chance to plan, but we also have to follow the information and the data and see what's coming in and what things are looking like. Regardless of when we move forward, there are some things that must happen for us to be successful. And I just want to spend a moment talking about those. Everyone must take their responsibility seriously. You know, we've talked about the way that people are responding, and that has been good overall. But as we move forward and we do start to think about opening things up, our risk for being in the midst of virus that's circulating will increase. So businesses really need to adhere to requirements and to guidance in order to keep their employees and their patrons safe. And I believe most of our businesses are doing their very best and trying to navigate that new norm for them. And again, the information that's out there through the Chamber and the various guidance from OSHA and the CDC is very helpful for them. I know that it's a work in progress, but businesses will have to do their part. Individuals also, we have to do our part. We have to avoid touching our face, our eyes, our nose, our mouth, and keep our hands clean. We need to wash them well, frequently. We need to use hand sanitizer when we can't do that. When we're ill, we need to stay home. And I know I'm not telling you anything that you haven't heard before. Call your provider before you go in if you're sick. Physical distancing, and you know, we refer to that as social distancing, but we've talked about that before. We want to socially maintain our connections, but physically we need to keep some distance. That 6-foot distance is what's recommended whenever possible. Use a face covering when you're in public and you can't maintain that 6-foot distance. So if I'm out running my errands and going to the grocery, getting my essential things, then when I'm in that store, I may not be able to maintain 6-foot distance at all times, but I can wear face covering and protect those people that may be coming in contact with me. And I hope that others will do that for me. Bottom line is it's common sense and good judgment and the protection of others as well as ourselves. So if we don't do these things, we are more likely to have to revert back and switch orders and become more strict again. And I don't think anyone wants to do that. Our staff and others that we're working with on a daily and weekly basis are assessing all the possibilities for how we might be able to move forward and kind of join in the rest of Indiana at some point. Exactly what that looks like, we're not sure yet, but certainly we are working on that, and that is part of the daily things that we're doing. Some other things, kind of switching gears just a little bit, our outreach. I've talked about our peer educators before, and they are hard at work, and we are pleased to say they've distributed over 80 kits to various downtown locations and people in those locations, providing education to them about that physical distancing, the importance of hand sanitizer and good hand hygiene, and wearing a face covering when they can't maintain that social distance. And they have provided service to people in Seminary Park, downtown Kroger area, 10th Street, Shalom, and other places. So they are working very hard. We're very, very proud of those peer educators. One question that we have received from some different places, and just to reiterate, the governor's plan does not allow Little League practices or games to resume until June 14th or after. And while local governments can be more strict, we cannot be less strict. So as it stands right now, the questions about Little League is June 14th or after. So I think that that's everything that I really wanted to talk about. Again, we're looking at all sorts of data. You know, when we don't have really huge numbers, and that's a good thing, but it also can make some of those daily graphs and things a little more difficult to look at. And we are looking to have that gating criteria lined out and be able to look and assess where we are so that we can move forward at the appropriate time.
Okay, let's go next to Allison Moore.
Thank you, Chuck. I have three quick things that I want to point out today. I see there's lots of wonderful questions in the chat, so I'll make it super quick, and that way hopefully we can get a lot of those questions for our media. I want to let everyone know that we did receive a small pallet of PPE for our first responders. That was released on Wednesday. Our office has sorted that to have our first responders to see how we can disperse that and what the needs are. And so I had last week that we had been notified we were going to receive, we weren't exactly sure how much. It was a little bit more, but we anticipated, which is always exciting. And we'll be distributing that to first responders the next meeting. So exciting news. We made those many requests for our first responders, and then we did get our first shipment of items. We are still collecting the homemade masks as businesses and thinking in regards of continuity of government in that returning phase. I know Monroe County government and then also the city is also looking at various things, and I know that masks is something that is needed. And so we are continuing to collect those, and we are continuing to gain lots of requests for those as well throughout the county. And so we have sites that are deemed appropriate for those. You are a homemade mask maker. And go to our county website, co.monroe.in.us. It's on the main page, but you can also click on the emergency management page, and there's a green link there with those addresses of those collected. This last week, we received a significant amount, in fact, hundreds of masks from people throughout the community. So I also want to express our gratitude and thank those that have taken the time while they've been at home implementing this stay-at-home order with their families, and they're also taking the time to serve others, and that means a great deal to our department and to the county and all of us. We are so grateful for that. So thank you to those individuals that have no idea who the people are to think individually, and so we want to express through this way thanking them for taking the time to do so. And I want to just echo what Brian said through last night around the Bloomington Hospital. On the flip side, being in the line with the first responders was just a phenomenal experience. It was really great for our first responders in the staging area, parking lot prior to the parade of lights. It was wonderful to see some smiling faces and just lots of first responders that have come together. They definitely tried their best to keep social distancing, but I was on a call earlier and I just expressed how I didn't realize how much I had missed those individuals and their faces and their beams of light, and how great it was and radiant it was for myself to be amongst those individuals. And so it was wonderful. We have been questioned by many people if we plan to do the same thing for others, and especially Monroe Hospital. And so I just want the public to know that we already do have something in place, and did have something in place even prior to this parade of lights in regards for Monroe Hospital and then other facilities that offer healthcare. So thank you for those suggestions and for those concerns that everyone wants to make sure that we in fact are showing support to everyone. We do support all of our healthcare workers across Monroe County, and we do have plans in place for supporting those other agencies and departments as well. So that's my report. Thank you.
All right, thanks, Allison. Sorry, your audio was cutting out a bit, but I think we got most of what you said there. So Ben Hunter.
Thanks, Chuck. I'll first point out for Indiana University throughout the state, we have new graduates throughout the state. So I want to thank our faculty and staff who did just a tremendous job in adjusting to virtual education. I also want to point out that we have a new PhD, and that's Dr. Chuck Tunny. So congratulate him as well. So on that huge honor. So we continue to do our planning. Not much has changed since last week. There's a lot of activity and a lot of different planning groups throughout the system on each campuses, our 7 campuses, and then we have the Restart Committee. We expect initial guidance coming from our Restart Committee next week sometime. We'll put all that together and start planning for hopefully what is some type of fall in-person presence on our 7 campuses throughout the state. And so we'll have additional updates, I think, in the coming weeks on that. Dr. Jay Hess, our Executive Vice President, is leading that effort. We have our 2 deans of public health, Dr. Allison, Dr. Halverson, also on that committee. And so they have been doing a lot of work in our environmental health and safety team here throughout Bloomington and IUPUI campus is also assisting. I will give just a couple quick operational updates. And so in some of these I know have been covered in newspapers. When we asked students not to come back and then various stay away orders or stay at home orders were put in place and the state put theirs in place, I want to thank both Monroe and Marion County. We worked with them to get special permission to do move outs and allow students and parents to come back with proper physical distance and PPE in place and scheduled. And so that is occurring both at the IU Bloomington campus and the IUPUI campus in Indianapolis. Those are ongoing. I know a lot of anxiety from parents and students. So I want to appreciate, just show our appreciation to both Marion County and Monroe County. It underscores what a relationship we have, but most certainly with the health departments and our emergency management cohorts there. The other thing that we have been working on throughout the system is just if we have an in-person presence in the fall, just our cleaning procedures. There's been a lot of activity in terms of our capital planning and facilities throughout the state. As you can quite imagine, the lead time on just getting hand sanitizer and Clorox wipes and is extended just as much as getting N95 masks. So we're in the process of getting all of that in place. And this is all items that thankfully that we will use over time, extended time. So it's, but we're also fighting the supply demands that a lot of other institutions in higher ed and corporations are putting on the supply chain right now. So we're working through that process. There's been a lot of effort in that area on all our campuses and with capital planning. The other news that affects IU Bloomington particularly is the Big Ten Athletic Conference extended their suspension of all organized team activities through June 1. Others have talked about the governor's plan and the local counties that have extended their stay-at-home orders. So we're navigating all of that. We've continued to tell our faculty and staff to stay at home and work virtually. Only essential employees are on campus right now. That could change as we ramp up research, but all of that is under evaluation. We hope to have additional announcements, and we're evaluating what both the state and the counties are doing in the areas where we have campuses located. I think I mentioned this last time, but I'll reiterate it. Another thing that our Emergency Operations Center, our emergency management folks are doing is that we're working on updating our MOUs with local county governments in terms of point of dispensing or POD agreements. So we're anticipating wide-scale antibody testing, and we obviously are anticipating, hopefully sooner than later, vaccine distribution. So we are making sure that our agreements are in place. I know there's been a lot of effort. We really do appreciate there's a lot of lawyers involved, as you might imagine, from many local jurisdictions. So we appreciate them coming together on that work. And so we hope to have those all hammered out in the coming weeks. And really, again, they're just updates. We've had those kind of pod agreements in place at various times. We have locations that are identified on all our 7 campuses. And so as those things start to pan out in terms of antibody testing and vaccine, eventually we'll be in a good position. Outside of that, we continue to monitor the public health advice, looking at the COVID numbers in all of the areas that we have an IU campus located. Our public health team is doing that. We're working with the Big Ten, our partners there. We've continued to work with other Indiana institutions of higher ed, particularly Ball State and Purdue. Our emergency management teams are constantly talking throughout the week. We're looking at what their plans are for the fall. We're looking at what organizations are putting out in terms of plans for the fall. And as we look through all of that and the best practices, we're coming together with an IU plan. So that's about it, Chuck. Thank you.
All right, thank you, and thank you for that acknowledgement. And I'll assure everyone that IU standards are still very high despite that fact. So now we can go to questions. David Askins was having a little difficulty in the chat box, so I'll call on him to ask a question here on the microphone.
Can you hear me, Chuck?
I can.
Actually, my difficulty was not technical. It was laziness. I didn't want to retype the question. I was not able to paste. In any case, I just want to preface the question by saying that I think it's obvious that the focus of local officials in Monroe County for their decision-making process is to protect public health, and that public health is your lodestar. So that's certainly appreciated, I think, by all of those county residents. And my question for Mayor Hamilton is not meant to imply anything different from that. But I do want to ask about the chart that the mayor's office posted on its Facebook page yesterday. It shows a cumulative daily case count with a trend line. And the words in the Facebook post say, quote, "Cases in Monroe County are not declining yet. The trend line graph below illustrates that," end quote. So I think those words indicate that as a part of the mix, one of the data sets that the city administration is considering before reopening is for the trend line on a cumulative chart to be downward. So I'm hoping that today, Mayor Hamilton, you can provide some clarity by explicitly rejecting that specific use for this kind of chart. That's the question. And then I have an additional question, one more after that.
Well, Dave, first of all, thanks. And we, of course, collaborate very closely with the health experts who drive all this, and you've heard from several of them. If what you're saying is in a chart that as a mathematical purpose cannot go downward, I agree with you in the sense that that's a cumulative chart, and so the angle can never go downward. We do want to see, as Ms. Cottle indicated, several indicators that suggest we're moving in the right direction, and that's what we're going to continue to do, and we'll collaborate with the health department and the health experts on that.
Thanks.
This is Penny. Can I just add on to that, Dave? Thank you for that question. And I will just say, yes, that particular graph, that trend line is going to continue to go up. But we are looking at, if you look at the bar graph and other things that will show us, what we're looking for is really the leveling off on the number of cases as they're coming in, and then a decline. So there are multiple graphs. That may have not been the best one for us to send that way, but thank you. And just know that we are looking at more than one piece of information, and we do recognize that as we do more tests, the total cumulative number is going to continue to go up. But we do want to see the number of positives come down. And again, that's why we're looking at that ratio as well, that percentage. So I apologize for any confusion.
Thanks very much. I appreciate the response to that question. And leaving the charts aside and the visual representations aside, I wanted to characterize some of the data in words. So if we look at the last 14 days of new cases in Monroe County, the average of new confirmed cases was 1.64 per day. And if we go to the immediately prior 14-day period, the average was 3.14 cases a day. And if we go 14 days before that, the average number of cases per day was 4.29. So for the last 3 successive 14-day periods, so this is a total of 6 weeks, the average number of Monroe County cases was 4 or around 4, dropped to about 3, and then dropped to 1.5. So why does that?
Today, and what we're seeing, part of it is that the numbers are very small, and again, that we're not looking at any one piece of information. And I think that we do tend to kind of focus on that downward trajectory. Shoo, I can't talk today. And those kinds of things, but we want to be very clear that we're looking at all of those pieces. And again, the more testing that we have, I think that the better feel for the amount of prevalence in our community will be better seen and identified. So it isn't any one piece of information. But you're right. We can look at the data in many different ways, and that's what we're trying to do. But we're also trying to not look at any one piece of information and let that one piece be the guiding force.
Okay, and we have a few questions here still to get to. So if everybody doesn't mind going a little long, I'm fine. Hang on here to get to those. This is again for Penny Caudle. Where is the new OptumServe testing site going? Who can get tested, and where exactly can people find the virtual platform? That's from Ethan Burks at WFIU WTIU.
Sure. Thanks, Ethan. Because people will have to have an appointment and they'll have to use the portal to get there, we're not necessarily publicizing the actual site. It will be downtown. I will tell you that. It's not that it's really a secret, but we want to make sure that people know not just to stop in and expect to get seen. And so people will be directed to an appropriate site. It will be open 8 to 8. I don't know if I mentioned that before. It is free, and I'm looking at the other questions. In terms of eligibility, if you are symptomatic for COVID-19 symptoms, and that could range from fever, cough, shortness of breath, difficulty breathing, and that's a new kind of difficulty in breathing, chills, repeated shaking with chills, muscle pain, headache, sore throat, new loss of taste or smell, kind of a combination of those things. If you are symptomatic, if you are asymptomatic but at high risk, I mentioned that before. If you're over 65 or over, have diabetes, obesity, high blood pressure, those kinds of things, then the last way is if you're a close contact to a confirmed case, and it's imperative that you continue to work or you have close contacts in a high-risk population, then you may be able to be seen without symptoms as well. Did I cover all of those? It is on the state's website in terms of where the different testing sites are. The state health department has a map, and they've got a place to find Optum registry as well. But we will be putting out later in the week, once we really know for certain when this is going to open, we'll be putting out more information about that.
Okay. Another question from Ethan. What results need to be seen in order to lift the county's declaration of emergency, and could that extend past May 15th?
Still on camera.
So anybody want to take that one on?
Well, I would just say that we are following data and we're following science, and so we rely on the county health department and Bloomington Health to give us that guidance. So Ms. Cottle will probably be the best person to answer that directly.
And again, I would go back to that gating criteria. And actually today we got some new information about how we might be able to look at that. So we'll be investigating that over the weekend. But looking at the hospital data, looking at influenza-like illness and COVID-like illness, looking at capacity, looking at our testing numbers or positives, the percentage, and just other general factors. You know, there is the hard kind of math data, and then there's what's also happening in our community. Are people following the restrictions now? Are we seeing a change because of that? So we want to take all of those things into consideration.
And I would just say that, yes, the current orders could be extended past May 15th. We hope to share that next week, but they could be. We don't know yet.
Okay, we'll move to another question. And again, I feel like Ted Koppel on Nightline. Tell our affiliates we're going to be running a little bit long here. So this is for Brian Shockney. Several hospitals around the nation have made significant staff cuts. Is this a trend that could reach IU Health, and has it already?
Thank you for the question. Yes, this has met layoffs and furloughs across other health systems. It has not with IU Health, and there are no plans for that with IU Health. Why? IU Health has been very good in our operations. We've been very planning forward in our operations. We have planned for these days as part of our new integrated service center in Plainfield, where we had a good cache of supplies of PPE, so we didn't have to worry about that. And so we had a good cash reserves, and we were able to continue to pay our physicians, our advanced providers, and all of our staff going forward. We saw the slides, I think it was a week ago, with the presentation in economic development, where healthcare workers were, I think, 4th or 5th on the list of the highest unemployment claims. That is not unusual across the nation, but IU Health is a very strong organization and has been and continues to be. And as we continue to go back toward operations, we will continue to operate efficiently, effectively. We want to be sure that we're providing the lowest cost care for our community. Healthcare is very expensive. And so we're ensuring that we're being effective and efficient in our care, and we'll continue to be, because we don't know this is over. We don't know that this might not happen again in the fall. And if it does, we want to be able to continue to provide our team members security and confidence that their employer can continue to keep them employed and support them in these times of need. So no, there's not been any reductions in force or any layoffs throughout the state with IU Health, and there are no plans to do so.
Thanks, Brian. This is from Emily Ernsberger from the HT for Penny Caudle and/or Mayor Hamilton. Aaron Predmore floated the idea at the City Council meeting Wednesday of closing down certain streets like Kirkwood Avenue for restaurant seating. Is that something that is being considered?
I can just quickly say yes, it is being considered, that along with other approaches maybe relating to signage and parking, and we're working very closely to look at any ideas and innovations that may help the recovery accelerate. So yes, it is being considered.
Penny, I don't know if you have anything to add to that. Otherwise, next question is coming to you, but if you have anything to add to that, we can do that first.
I think people are being creative, and I've seen conversations that people are having about that, and I think that in this situation, people will continue to be creative. They've been creative in how they've maintained some of their businesses during the closures, and I think we look at everything that we possibly can.
Okay. So again, from Emily for Penny, when the governor talks about running at half capacity, what does that mean for retail stores? It makes sense in regarding for restaurant seating being at half or 75% capacity, but for stores, how does that work? Will there be local enforcement of that when local businesses open up?
Emily, that is an excellent question, and it is it's a tough one to answer, but we did find, I had a staff person who actually found kind of a calculator, if you will, and there are some different things that people are using. Some people are looking at, what's the fire marshal, which we know that would be a really crowded, but they're maybe looking at 20% of that as a means to kind of give them a guide on some place to start. Can be very difficult, because you may have a store that's very full of things. And so the walking around space is very limited. But there is a calculator that one of our staff people shared yesterday during the business, and I believe it is banquettablespro.com. And it's a calculator you can put in your space, how far you want to distance people, and it will kind of give you an occupancy. So at least that's a guide that somebody might use. Very difficult to estimate, and different businesses are certainly doing it differently. I think that I remember reading when Walmart was doing this, that they had some sort of calculator that they were using as well. So there may be some businesses out there that can share what models they've seen. And certainly a lot of the guidance out there is just, it's guidance, and I think every business will do the best they can. And if we have issues, then the health department will have to try to figure that out as well. There's no easy answer to it.
I was just going to add, and by the way, I'm coming in and out of visuals because I'm trying to reduce the bandwidth. I don't know if it helps any, but anyway. Yeah, it's a really good example, for example, to think about the mall. The mall may have an overall population restriction, but if everybody crowds into one store, that's obviously not going to be a safe situation. So the enforcement and the planning is quite difficult and complicated. We do depend a lot on compliance from business owners, and I think the vast majority of them are trying to really figure out how to do the right thing. I appreciate, again, the work of the chamber and others, excuse me, to help facilitate that. And as Ms. Cottle said, the health department can step in, but there are some situations that we gotta figure out how we would oversee that. And the mall's one example where you can have an aggregate number, but it depends on if everybody's concentrating. Same in a store. If you have aggregate numbers, if everybody concentrates in one quarter part of the store, that's a problem. So we have to watch that carefully.
Okay. All right. Well, thank you everyone again for your good questions, and we will do this again next Friday.
Thank you, Chuck. Appreciate it.
Thanks, Chuck. Congratulations, Chuck.
Yeah, Dr. Carney.
Thank you.
Congratulations.
Awesome. Congratulations.
Thanks.
Thanks, everybody.
Thank you.